Hi everyone, I'm Casey. Welcome to Analyze with Casey. Today we're going to be looking at healthcare and a hospital data set. When we embrace the imperfections in our data, we're embracing the imperfections in the world around us. Just like we as humans are imperfect, so is our data. And treating it as anything other than such is a huge mistake on your part, especially from a regular business perspective, and it directly harms patients in a healthcare perspective. But why should you take my word for it? I do have a few degrees, but I'm here to teach you what I know for free. If you believe that learning from the truth is more valuable than a polished report, then this is the right channel for you. Today, I'm going to show you why being honest about your data can lead to better decision making. I'll walk you through a real example using public healthcare data. Here's an example. I would love you to follow along with me as I walk you through these steps. So we're going to go to datacms.gov. We're going to scroll down to hospitals. We're going to click on view top and we're going to scroll down. We're specifically looking for patient survey results. We're going to look at the survey of patient experiences. Scroll all the way through this if you want to take the time. The Centers for Medicare and Medicaid Services, along with the Agency for Healthcare Research and Quality, developed the HCAHPS, Hospital Consumer Assessment of Healthcare Providers and Systems Survey, also known as hospital CAHPS, to provide a standardized survey instrument and data collection methodology for measuring patients' perspectives on hospital care. The HCAHPS survey is administered to a random sample of patients continuously throughout the year. CMS cleans, adjusts, and analyzes the data, then publicly reports the results. The HCAHPS survey is 29 questions in length. CMS currently reports results for 6 composite topics, 2 individual topics, and 2 global topics. So you can read all this if you would, or we can scroll to the bottom, and we're going to look at national data for this episode. We can see here that this was last modified January 8th, 2025, and it was released February 19th, 2025. I want to download the full data set. We're going to hit yes, download, and we're done. So once we have our file downloaded, we're going to make sure to save it as an Excel file. And one of the quickest things I like to do is if you go up here to insert and hit pivot table, it's going to automatically pick up on your table. You can scroll and make sure you're at the bottom. But if you have hundreds of rows, you're not going to want to scroll like that. So we'll put it on a new worksheet, and then we can check here and add this data to the data model as well. We're going to hit OK. Now we can see our options here. We are going to drag our question to the rows and our percent to the column. This data is not very nicely organized. This does not help us that much. We're going to drag the measure ID up here because whoever created this data set knew what they were doing, and they put labels on each question that help us quickly organize the information. So here we can see that these 3 responses are all to the same question. So 23% of patients usually received bathroom help as they wanted. 10% sometimes or never received bathroom help as they wanted. But 67% of patients always received bathroom help as they wanted. While the highest percentage here, 67%, always received bathroom help, 10% and 23% didn't receive quality care. That's 33%. While that doesn't seem like a lot because it's not the majority, that's still 33% of people that did not get to go to the bathroom when they needed. This is quality care we're talking about. We need more funding for more training and more staffing. All right, so let's throw a quick chart in here. If we go back up to insert, we can choose recommended charts, and it's going to give us all of these questions in one chart. We're going to hit OK. And then up here, we can filter down. If you hit the select all button, That will unselect everything. And we can look at, well, we already looked at the bathroom questions. So we'll look at the call button questions, hit OK. And that's going to affect our graph as well. So once we open it up, we see our 3 questions here. If you go up to the design tab, you can quickly add data labels. I like to add them outside the end. Now we're going to do something that I love to do. We're going to benchmark our data. I'm going to specifically pull Kentucky data because I live in Kentucky, and then I'm going to compare it to the national rates that we've already looked at. I've went back to the website and I have downloaded the state data set. And this includes every state, so you can download the same data set and explore your state. It's got every same question, exact same data set. You can just filter by your state. And as you see here, I've got it filtered down to Kentucky. I'm going to simply copy this and paste it next to our national data set here. So we can quickly compare how Kentucky benchmarks to the national average on these questions. So way to go, Kentucky. We're 2% above on patients who report that they always receive help when they hit their call button. When we stop smoothing everything over, that's when we see the real picture, and that's when real insights emerge. While that's great that we're above our benchmark, there is still 33% of patients who either sometimes or never receive help after hitting the call button. This is a huge problem, and this is why we don't just present the good data. We have to look at where the disparity is and what we can do to improve it. For a long time, I tried to make everything look neat and polished because I thought that's the way data is supposed to be, and that is the way that reports are finished in the process. But real data is messy, and that messy data is important. Data has gaps, unexpected details, and surprises that can reveal real hidden stories if we're willing to look. Thank you for spending this time with me today. Remember, real insights come from looking at the data as it is. Messy, surprising, and full of hidden stories. Stay curious. Keep questioning. Let's continue to uncover the truth together. Now, I want you to try this yourself. You pull the data. You compare it to the state you're in. Tell me about your findings. Comment, like, and don't forget to subscribe to find more insight.